Good morning, everyone. I hope you're doing well. I want to thank you for taking the time to join me this morning for my presentation. I do appreciate each of you being here. However, before I begin, I do want to put emphasis that I am being graded on this presentation, and I need your participation to assist in the grading process. So if you recall on Friday, I emailed each of you an evaluation form that you can fill out either during the presentation or take notes of my presentation and complete the evaluation form afterwards. I do ask that once you complete the form, that you submit them to Alicia, who will then turn them over to my professor on my behalf. Thanks. A little bit about me. My name is Sarah Rocky. I am currently enrolled full-time at Santa Fe College, obtaining my Associates of Science degree in the Health Information Technology program. I'm also enrolled at Lake Sumter State College in Claremont to finish out my requirements to graduate by end of spring. I'm also currently employed full-time at Orlando Health in the HIM Release of Information Department. I work at South Lake Hospital providing medical records to patients on demand, as well as providing medical records at the request of outside physicians for continuity of care. My achievements to date are obtaining my Certified Coding Associate Certificate through AHIMA last year, completing the Coding Certificate program at Santa Fe College last summer, and completing the Emerging Leaders and Engaging Leaders workshop, both which were 8 weeks long sessions which were done through Santa Fe College. By the end of this month, I will also be taking my HEMA certification, the RHIT, and graduating with my associate's degree for HIT. Also, I would like to take a moment to highlight someone in attendance today. I would like to introduce my professor from Santa Fe College, Professor Julie Shea. She has instructed most of my courses that I've taken through the program and has provided me with a wealth of knowledge outside of the core curriculum. And most of all, has been my biggest supporter, who provides me words of encouragement and guidance when I've needed it most. So thank you so much for being here, Professor Shea. For today's presentation, I will go over the following topics. I'll define what the Cancer Registry is, who works in the Cancer Registry, defining reportable versus non-reportable cases, and the 3 elements that make up the process of reporting a cancer case, data of lung and colon cancer statistics for 2019 and 2020, specific to Orlando Health, reported national data of leading causes of cancer-related deaths, and finally, concluding my presentation. Upon initial reflection on my internship, I felt it was best to start with what is the Cancer Registry, and why the emphasis for accreditations for the Cancer Institute at Orlando Health. Referenced from the SEERS training modules I completed during my internship, I learned that the Cancer Registry is an information system designed for the collection, storage, and management of data on persons with cancer. The Cancer Registry plays a critical role in cancer surveillance, which tells us where we are in the efforts to reduce the cancer burden. Registries are imperative for the purpose of early detection and sooner treatment options for survival. So with this being said, cancer data can be used to track environmental factors or high-risk behaviors, and thus the cancer data is used also to choose the most appropriate plan of treatment depending on severity and age of the patient. It wasn't until I witnessed it myself during my internship at Orlando Health Cancer Registry that I realized the amount of people it takes to process the cancer data and report the cases as necessary to state and national registries. You'll see at the top here is Alicia, Orlando Health Cancer Institute Vice President. Next is the Oncology Program Coordinator, Jennifer. She brings oversight of cancer program accreditations at Orlando Health Cancer Institute, including Commission on Cancer, National Accreditation Program for Breast Centers, and National Accreditation Programs for Rectal Cancer. Alongside Jennifer is Alicia, who was my internship mentor, who is a supervisor of the Cancer Registry. Within the department, she oversees the team of registry reps and cancer registrars that process the cancer cases to be reported. It is also noted that there is an outside vendor, a contracted team of CTRs, that assists in abstracting and staging cancer cases for Orlando Health Cancer Registry. I found that the Cancer Registry comes down to 3 elements that attribute to the reporting of cancer cases, which are case finding, abstracting, and cancer staging. To begin, data combing is done in the electronic medical record database to search for keywords and diagnosis codes to alert possible cancer cases. These records are compiled into a spreadsheet, and it is up to the case finders to go through each chart to determine if the patient's case is reportable or not. Some examples of keywords to look for in determining this include appears to, most likely, presumed, probable, or suspicious. Terms that are not to be interpreted as involvement include cannot be ruled out, possible, questionable, rule out, or potentially malignant. These identifying markers can be found in pathology reports, radiology reports, or disease markers. As defined by Sear's training module, Introduction to Staging, staging is shorthand method for describing a disease. A coded format, such as numerical systems with increasing values, meaning more involvement or severity, allows for electronic analysis of cases with similar characteristics. It is the grouping of cases into broad categories based on the extent of disease. When it is determined that a cancer case is actually reportable, the case finder will mark the case as suspense, and thus the case is then delegated to the cancer registrar to abstract and stage. This process is done through the reporting platform called CR Star. Types of data that are collected for reporting purposes include demographics, such as age, sex, and race, the MRN of the patient, accession number, which is a unique number to each individual case, the patient's social security number and spouse, the team of physicians taking care of the patient, and the employment of the patient, cancer identification to include the anatomic point of origin, staging of the cancer, treatment to include first course of treatment and subsequent treatments, and follow-up with the patient, reoccurrence of cancer, and even death of the patient. Once all of the information has input into the system, the cancer registrar would then need to run edits to make sure the data that was entered corresponds with each other, meaning if any data is contradicting, it would not be able to be submitted until the items were resolved. So after all information is made into useful data, we can look at it with meaning. With the assistance of Jennifer, she was able to pull data for me regarding specific parameters to set a focus on diagnosis of reportable cancer at Orlando Health. More specifically, the data that was extracted from 2019 and 2020 of patients who were discharged from Orlando Health with the primary diagnosis of lung cancer and colon cancer. As you can see from this bar graph, in 2019, 215 patients were discharged with the primary diagnosis of colon cancer, and in 2020, this number fell to 138 patients being discharged with the same primary diagnosis. Looking over at the lung statistics, in 2019, 589 patients were discharged with a primary diagnosis of lung cancer. And in 2020, these numbers also dropped, and the number of patients discharged with a primary diagnosis of lung cancer was 521. We thought it would be interesting to pull data regarding staging at time of diagnosis at Orlando Health between 2019 and 2020. And on the far right, you'll see that there is a key legend that indicates staging 0, 1, 2, 3, and 4. Stage 0 means that there are abnormal cells present but have not spread to nearby tissue. Staging 1, 2, and 3 means that cancer is present, and the higher the staging number, the larger the cancer tumor, and the more it has to spread to nearby tissue. And stage 4, meaning the cancer has spread to distant parts of the body or has metastasized. And as we can see in this representation, for lung cancer, most of the patients were diagnosed when they were at stage 1. The second highest number of patients reporting initial diagnosis at stage 4, which, as I previously mentioned, this is when cancer has spread to distant body parts. For colon cancer, you'll notice that a large portion of patients are initially diagnosed with colon cancer at stage 3 or stage 4. I believe that colon cancer is staged higher upon initial diagnosis due to not knowing the disease exists until the patient begins exhibiting symptoms. And by then the patients are evaluated, the cancer has already progressed into a higher stage. I believe lung cancer is more quickly diagnosed at an early stage because chest x-rays are taken routinely, and masses on the lungs can be found from the x-ray, which would then prompt for an MRI to definitively diagnose each cancer. And then I performed my own research, and I was able to pull data from the National Vital Statistics System regarding ranking of cancers on a national level. Lung cancer is the leading cause of cancer-related deaths, making up about 25% of all cancer-related deaths. Colorectal cancer is the second leading cause of cancer-related deaths in the United States. And it should be noted that deaths were classified using the International Classification of Diseases, the 10th revision. Cancer deaths were identified using underlying cause of death codes, which are C00 through C97, which are the malignant neoplasm codes. And then to conclude, my time here at the Cancer Registry was eye-opening for me. I realized the impact the team of registrars and reps are as a whole, and I love the focus Alicia puts on training and educating the team on an ongoing basis to be well-versed on guidelines and processes of the Cancer Registry. Accreditation is important for the Cancer Institute for many reasons, but to briefly summarize, since I didn't get to touch on it too much during my presentation, the accreditation is a voluntary commitment aimed at making sure that a cancer program offers a full range of services to the patients and to their families, but also the Cancer Commission offers significant benefits for the cancer programs, the patients, and their families, as well as the communities. Another important part of the Cancer Registry I didn't get to touch on was the cancer conferences that occur behind the scenes. I met with 2 cancer coordinators during my internship and gained some knowledge on their roles. Cancer conference coordinators are responsible for coordinating different aspects of the multidisciplinary cancer conferences, the MCCs. I believe Orlando Health Cancer Institute has about 9 conferences that occur each week. These are sessions meant to discuss patient cases, their status, and to discuss the best course of treatment. I learned also the life cycle of cancer case. I learned also the life cycle of a cancer case from beginning to end, and also from the data I pulled from my own personal experiences. Seeing someone with multiple metastatic cancers brings emphasis on why getting routine checkups are crucial to your health. Seeing patients initially being diagnosed with colon cancers at stage 3 and 4 was a hard pill to swallow. Thank you again, everyone. I have enjoyed this experience immensely, and I appreciate all of you who took time to bring light on your job roles.